Hello, everyone. Thank you for joining us. Today we have Kimberly Bennett from the Homeschool Counseling Network, Sue Han from Maple Psychology Services, and Amy Bodkin. Thank you guys so much for joining us. We are going to be talking about early screening and how you can be able to implement that in your homeschool. A lot of homeschool parents do not think that this is something that they are qualified to do. They think that this is something they don't have access to. So we are going to be really diving into how you can be able to implement this in your homeschool. Before we get started, I want to share a link to the Homeschool Quest Back to School giveaway. We just got 3 new prizes from our sponsor, My Homeschool Village. Thank you guys so much for sharing that. They're giving away 1 month subscription to every single one of the prize winners. So we are going to have 3 prize winners. So I'm going to go ahead and share a link in the comments to that giveaway so you guys can enter to win if you guys haven't already. Okay, Amy, I believe that you're going to be sharing first. Let me go and switch over to you.
Okay. Okay, we're switched now. All right. Well, my name is Amy Bodkin. I work at my business, Amy Bodkin Consulting. And when it comes to children, like, we all pretty much go and take our kids to see a pediatrician once a year, right? So the reason we're taking them in to see the pediatrician isn't just because, well, everybody says you should do it. The reason is because we are trying to make sure that we're staying on top of like weight and height and growth and development to make sure that there aren't any signs that we've got some kind of underlying health condition that's gone missed. Because the longer you miss something like that, the more challenges that come up that then have to be addressed. And sometimes it can make it a lot harder to get the kind of help that you need. And it's the same way, honestly, with learning and development. It's just pediatricians aren't specially trained to always look at all of those things, especially some of the more specialized processing differences. And so in a lot of ways, it can be a great opportunity if you have access to like a family therapist, or if you want to get a referral to a speech therapist or an occupational therapist. Those are excellent people to get a referral to from your pediatrician, because they can look closer at basically the things that we need to learn and grow. Because a lot of the early development in childhood, it's focused on language development and motor development, and both of those things are going to be covered with speech and OT. And if you get a referral, all you have to do is take them in to get an evaluation. It doesn't tend to be as expensive as doing like, a big autism evaluation or something like that. And the most common delay in childhood is speech. And we can also make a huge difference in a child's ability to speak and honestly have good oral health if we address those things early. Not only can it lead to kids feeling kind of like, oh, I talk weird, and being embarrassed about how they sound, but it can also, if you see a speech therapist, they can also look for things like motor delays or inflammation that is impacting muscle development in the mouth. That then has a huge impact on how much money we're going to be spending on braces down the road. So if we kind of like look at all those things on the front end, it's not as big of a deal. And a speech eval and occupational eval are open to anyone. If you go private, they're open to anyone who can pay. And if they say, hey, you're looking great, well, then that's wonderful. You didn't do anything wrong. You found out, hey, we're doing okay. If there is an issue that crops up, you don't have to have a big scary diagnosis if you're not ready for that yet. It could be something like, hey, you've got some articulation issues. Let's do some therapy once a week to see if we can't like fix that, and maybe we'll be done in a couple months. You never know. It might be something that's not a big deal. And addressing speech delays can be huge for language development and also for reading development down the road. So if we don't address those speech delays, it can actually impact our ability to learn to read and spell later. So it pays off big dividends. Speech therapists and occupational therapists and physical therapists too, but especially speech and OT, I love to refer to them. I think they're like the first stop for parents when they're kind of like, I feel like something's off and I don't know what it is, but I'm not sure. And I don't really want to like invest in a big evaluation when I might be wrong, because that's what they do. They spend time every day with parents kind of going, hey, what's going on in there? What do you need? Do you need some support as a parent? You feel like language isn't happening well, whatever it is. So those are some wonderful resources. And actually, when my kids were little, we got a speech therapy and an occupational evaluation for both of them before we pursued a diagnosis. Both my kids are autistic as well as I am. And I wanted to go ahead and get them help, but as a kid, I had been diagnosed with ADHD, and what we realized through the process was that that's not the only thing going on. And because of that, we needed to, oh, wait, I just went back. Oh, I know why. Okay. So anyways, because of that, we needed to get them some support, but I wasn't really ready to go ahead and be like, okay, I am ready to accept a diagnosis. Hold on. Am I charging? I'm not charging. Hold on a sec. I forgot about the power. I'm good now. Okay. Yeah, there we go. All right. So anyways, we went ahead and got them support through therapy. And then we just continued with therapy until we were ready to go through the diagnostic process. Now, eventually we did become ready to go through the diagnostic process. And quite honestly, paying for speech and OT out of pocket were definitely some motivating factors. If it had just been something small, like an articulation issue, then we might have just done speech out of pocket and never worried about it. But because it was autism, they needed more support. That was a motivating factor for getting a diagnosis. But you don't always have to get a diagnosis to get help. And you can also access some supports through your public school system. Most states won't bar you. Sometimes they will try to say that homeschooling isn't the same thing as private schooling, and so therefore they don't have to provide services. But most of them, you can get those services through them if you want to. But there's pluses and minuses both ways. And the most important thing about a doctor, a therapist, a psychologist, whoever, it's making sure that it's someone that you can connect with and that you trust, and especially that your kids like. If your kids don't like them, go find somebody else. So I'll wrap up real quick. I have a free offer for you guys. On my website, if you go to amybodkin.com, under Connect, there is a membership. And in that membership, I include free yearly testing for every family that's in my membership group. It's general screeners to kind of see, okay, where are we developmentally? And then I provide support year-round for families and for kids, trying to help them figure out how do we become our best selves? What are our bodies asking us for? What is it we need? And it's kind of basically your way of getting that support and someone to back you up who has a lot of knowledge about child development, because I used to be a school psychologist. And so I'm taking all of this knowledge from being autistic, being a former school psychologist, and also homeschooling 2 autistic children myself, to kind of help you navigate through a lot of the different options available, because there are a lot of options and you can't do everything. We don't have the time and money to do everything. So if you want to take advantage of that, it'll give you 1 month free. If you use the coupon code 1, like the number 1, month free. And you can check it out if you want. Was that fast enough?
You did fabulous. So I went ahead and shared a link to your website and the coupon code in the comments so that everybody can be able to get access to that. Thank you so much for joining us, Amy. I think that was very helpful.
Thank you.
I'm going to switch over to Kimberly. I believe you wanted to go next.
Yes, if that's okay. Well, I can't say enough wonderful things about Amy. Both Amy and Sue are members of the Homeschool Counseling Network, the free advocacy and resource website that I have for helping bridge the gap between homeschooling families and mental health professionals, or in the areas of coaching, consulting, and counseling, to help support home educators on their home education journey. So I'm grateful to both of these ladies for having been here today. Amy is a wonderful author. She has this great book that we talked with her about. She was featured in our Bibliotherapy book club feature last month. called Special Needs, or titled, sorry, Special Needs Kids Are People Too. So please go check that out. I have to just plug Amy on that one because she's a wonderful historian and a wonderful researcher and a wonderful clinician. And I'm telling you, that book, well, if you're not familiar with all of the jargon that we use, she will break that right on down for you and provide you with lots of case studies and support. So please, by all means, go and check that out. And I'm going to talk a little bit in just a minute about Sue Hahn and how she has helped out with the Homeschool Counseling Network as well. But today I am excited to be here with HQ on this collaboration for early screening and mental health. And what are the benefits of it? If you don't know me, my name is Kimberly Bennett. I'm a licensed professional counselor. I've been practicing for over 20 years, and I am a homeschooling mom. And we are in the middle of our 6th year as a homeschooling family. And Amelia, I'm going to go to you back and forth. She's kind of my tech lead on this too. Do I just click and it'll shift the page, the slides for me while I'm speaking? Yes, it will. Woohoo. Okay, so a little bit about the Homeschool Counseling Network. What do we believe? We believe all homeschooling families deserve access to affordable and quality counseling resources and support. And we are committed to finding professionals with the knowledge, experience, and understanding necessary to support homeschooling families through their practices and businesses. We know that can present a challenge. So we pretty much were created to help bridge that gap. What is our mission? Pretty much to connect homeschooling families with those quality and affordable coaching, consulting, and counseling resources to inspire, inform, and improve lives. And so here's our outline of what I'm going to talk with us about today. We're going to focus on the W's, and there is even a W in the how, the why we want to do early screening, mental health screenings, who and where do we get these screenings, what is involved with these screenings, how do we find a provider to help us with these screenings? When should we seek out a screening? And then we're going to come back full circle at the end and talk about, again, the importance of why we want to do mental health screenings early. So let's start out with why. Part of our mission at the Homeschool Counseling Network is we are big on advocacy and awareness. October, when this is actually airing right now, happens to be National Depression and Mental Health Screening Month. So what better month is it for us to focus on these issues? Mental health, Amy was talking about it earlier, so I'm going to piggyback on that, is just as important as your physical health. We think nothing about taking our children in for those annual checkups. If you're adults like us, we get around to ours a little later, but I'm going to talk about that more, about the importance of making sure we don't skip over our own screenings, because as parents, we do tend to put ourselves lowest on the totem pole if we make it on the totem pole at all. So we have to remember to take care of ourselves. But mental health is just as important as your physical health. And mental health is another component of overall wellness. NAMI, which is the National Alliance on Mental Health, on mental illness, estimates that approximately 50% of lifetime mental health conditions begin by age 14. Think about that. About half begin by age 14, and 75% begin by age 24. Adolescence actually doesn't end when you turn 18. Adolescence extends more when you talk about brain development and maturity, more to about age 25, possibly higher. So why do we want to focus on this? Because these are the age ranges when the majority of mental health diagnoses are actually going to present themselves, or when you're going to start showing symptoms of these. And the more we talk about something, the less afraid we are of it. We remove that stigma surrounding it. Okay, click. There we go. Okay, what are the other whys? Well, Amy mentioned it earlier. Early screening equals early intervention, which equals better outcomes. Some more statistics from NAMI. The average delay between when symptoms start presenting themselves, or when you start to notice what we call the presenting problem, when you come into therapy or when you come in to seek services, whatever's causing you distress at home. That's what we call our presenting problem. So the average delay in between the time when those symptoms first start to appear and you actually seek help for those symptoms, or intervention, as we call it, is actually 11 years. Can you believe that? That's from NAMI, 11 years. And that's just for youth. We're not even going to talk about adults. That's a long time to suffer. That's a long time. As you're going untreated with those symptoms, they're not going to get better. They're going to get worse. Here's a quote from NAMI. We've found that early identification and treatment leads to better outcomes. Early treatment may also lessen long-term disability and prevent years of suffering. Healthcare screenings are common in this country, and mental health screenings should be no exception. At HCN, the Homeschool Counseling Network, we are all about trying to bridge this gap, to help bring more information to you, to help bring more provider resources to you. We have multiple directories at our website for providers in all areas of mental health, from licensed professional counselors, social workers, marriage and family therapists, psychologists, psychiatrists, treatment centers, all sorts of different areas where you can search through based on your state or your presenting problem or what licensure status you're looking for professionals to help meet you where you are from all over the United States to help you in your presenting problem. We even have, as part of that, a free resource list, a one directory list that we have there committed to free and reduced cost resources. And that's pretty hard to come by these days. So let's move on to the who and the where. So who normally refers or who normally conducts these assessments? Actually, for the very, very beginning part of it, it's going to be like your primary care physicians, your pediatricians, or your family practitioner offices. When you go in for those annual checkups at your pediatrician or your primary care, whomever sees your child, they're going to ask you a lot of different questions about how they're developing, how are they growing, how are they feeling. If you've got an older child, you may have already noticed, they're going to start asking your child that directly. And what they're doing is kind of not totally what we would call a mini mental status exam, but they're going to see if there's been any major changes in their behavior, in their mood, in their feelings, and in their thoughts. Where we would normally traditionally see this is in public education, kind of like Amy was talking about earlier, where those services are present. This would typically be performed by school counselors, school psychologists, school nurses. That is where they're going to be the front lines, typically, where they're going to find out if we've got these behavior changes or if we've got these challenges. So we're not going to see that in the homeschool because we do have access to those services, as Amy was telling you, and in the states, but they're not going to be the first in some states, but they're not going to be the first person who sees it when you are a homeschooling family. Here's the beauty and the advantage of being a homeschooling family. Your children are with you all the time. So you're going to be the first person to notice those changes. That's one of the beautiful and unique advantages and benefits of being a homeschooling family. Your children are with you. You're going to know if there's been, you're going to have those observations firsthand. And plus, you know your child or your children better than anyone else. You are your child's best advocate. Amy was sharing a story about when she got early assessment and early screening early on. I did something very similar in my homeschool. We started with, our son was a preemie. And so I had a pediatrician at the time who kept telling me, oh, we adjust them until they're age 2 for this, that, and the other. Well, I knew, even though he's my only child, and as we kind of joke, he's the practice kid. We're always figuring it out with him because we don't have any siblings to compare it to. But I knew in my gut that he wasn't learning to walk quite the way other children should. And I knew this is not developmentally how that is supposed to look. I knew he wasn't hitting those milestones in a timely manner or in the order that he should. Crawling is important. It builds up strength for other milestones. So what did I do? I fired my pediatrician and I went and found a pediatrician that would listen to me, that wouldn't kind of approach me from the angle of, oh, you just have first mom anxiety. Well, yeah, I did for a little while, but you know what? I also know my child. And so instead, I had to really push to get those screening services. And I did. We did something very similar to Amy, where we started with OT. And after a couple of years in OT and PT, then we did an assessment later on. But those services made such a great impact on our son's development that, well, he was kind of able to mask, for lack of a better way of putting it, mask one of his diagnoses for a couple of years, meaning he has dysgraphia. That's one of his diagnoses. Well, we didn't require him to do a lot of handwriting in the first couple of years as a homeschool student. I would scribe for him, or he would learn to type pretty early. It was only when we switched to a hybrid homeschooling model and he had to go somewhere else that those issues became more evident and more prevalent. And we'll talk a little bit more about that in just a few minutes, about how noticing changes in behavior. But yes, we have that advantage of noticing those changes in how our kids are relating to each other, either to their peers, how they're relating to us, how they're relating to their siblings or not relating to their siblings. Those are all different, all forms of information and all grist for the mill to help us really observe and pay attention and know that something's going on here, something that we need to pay attention to. Trust your parent gut. So, what is involved in a screening? I'm going to speak from a mental health perspective. So, for us, it's a conversation. Let's say you've gone to your pediatrician and you've said, okay, here they're going to do their basic screening, which is part of them doing their full wraparound care. And they've now referred you to a mental health professional like me. I'm a licensed professional counselor. What's going to happen if you come to my office? Well, I'm going to gather background data. I'm going to talk to you about your history, about your child's development. I'm going to take some background information. I'm going to ask you what brought you in to see me. And we're going to have a conversation and really just get to know each other so that you can get comfortable with me as a provider. If you're not, it doesn't matter what the letters are at the end of your professional's name. It matters now. It matters as far as therapy goes. It matters how comfortable you are with the person that you're seeing. There are certain things your professional does need to be trained, obviously, and Sue is going to talk about that in just a minute. And Amy could have spoken to that too as well when she was a former school psychologist. If you're administering certain instruments like psychological testing or achievement or IQ testing or ability testing, yes, you do need to be trained for that. And it's typically going to be a school psychologist or a clinical psychologist or a counseling psychologist. So that's different for training. But when it comes to the therapeutic relationship, it matters how you feel about working with that person. That's the strength of that therapeutic relationship. But if you're coming into my office, we're going to talk about what has brought you in. You might be answering a few questionnaires that talk about the different symptoms. Let's say you came in because you've got a child who's worrying all the time. So I might give you a screening instrument that kind of will, and I may give it to you to fill out, but more than likely I'm going to sit there with you and walk you through it so that I can check off some of your answers to see how you feel about that and to see how you can give me as much data as possible about what brought you in to see me. But mainly it's about building that trust. Okay, let's see. Checklist of questions. I talked about that you're going to have at your PCP. Or at your pediatrician. So how do you find, and if I'm going too quickly, I'm trying to stick to my time frame here, but if everyone's doing okay, I'll just get a thumbs up from my other presenters. Okay. So how do you find a provider to administer these screenings? Well, for starters, you can go to your primary care and they can give you a list of referrals. But as of 1996, we have what is known as the Mental Health Parity Law. And what that means is that mental health was put on equal standing with healthcare. That means insurance companies, if you pay for insurance, most people want to use it or need to use it. We can talk in another expert panel, perhaps sometimes, of the reasons, the pros and the cons of using your insurance. I don't have enough time to go into that today, but if you want to use your insurance, one of the first places you're going to go is be thankful for this mental health parity law that started in 1996 and then was expanded in 2008 and then expanded even more when the Affordability Care Act came out in 2010. What that means is that your insurance now has to cover on an equal footing your mental health care. And there's no better evidence of this. This is my insurance card. Then if you take the insurance card, if you have private insurance or if you have insurance through your employer, and when it's issued to you, if you flip it over on the back, the second phone number that you're typically going to see, I really need new readers, is going to be a particular provider number for mental health and substance abuse providers. This lets you know that your provider is going to be in network. Believe me, if you want to use your insurance, you want to use someone who is in network because the fees of what you're going to pay for that care is going to be a lot higher if you use a provider out of network. But all you have to do is call the mental health substance abuse provider on the back of your insurance card. And the person there will connect you with someone in your area who is able to help meet your needs for what you are looking for. You can tell them a little bit about what's going on, and they can help provide a provider in your area who is trained and who is in network for care. So that is one way. You can also use your Flex Care or flexible spending accounts, which is where you put pre-tax dollars in to a bank account in a way. For terrible way to explain it, but it covers a variety of healthcare costs, including medications, and you can also use it to pay for your mental health care. We have employee assistant programs, EAPs. When I was back in private practice, I was on several of these panels. What this is there's really, mental health doesn't exist in a vacuum. You can take your problems from work home with you, and that can cause issues, and you can take problems that you may be having at home back to work with you. And it can impact your work, and it can impact your home life. And guess what? That's going to impact that company. So what a lot of companies have started doing is informing employee assistance programs. What this does is it offers a limited number of sessions for where you can go and see a therapist. And usually these services are provided definitely to the employee, and they usually extend to the employee's family. And it's usually solution-focused, brief sessions to help you resolve any short-term counseling issues that you may have going on. And it's free. I say free because it's part of your healthcare benefits of an employer. You can also go to the Homeschool Counseling Network and look through our provider directories. If you look under the Parents tab on the menu bar, you will find that we have a directory, one directory, that is devoted exclusively to free and reduced cost providers in every state. Most of those are actually run by the state, or they're Medicaid-related programs, but there are still some services there. We do have new providers that are joining our network and are offering reduced cost care every day. So make sure that you subscribe to our newsletter, and you'll be able to see updates as we update those directories. Another useful resource of where you can go to find someone who can administer screenings is going to be university training clinics, graduate students where they are learning to be counselors, learning to be psychologists, learning to be mental health professionals. Those students have to practice on someone. So oftentimes those university-based clinics will offer a reduced fee service for families who need to come in and they want to have a screening. They'll even offer therapy services. They're getting the training that they need to learn to be helpers, and you are getting great care. It's not just that you're getting care from just a student. That student is being monitored by an entire team of professionals. So you're getting extra care. You're getting pretty much a team of professionals when you're just seeing one clinician face to face. So they're going to be reviewing those recordings with their supervisors later. So they get to learn and grow, and you get the benefit of it as well. Okay, so when should I seek out a mental health screening? We talked early about looking for observable changes in behavior, habits, mood. Two of the biggest questions that I would say is to start with these two. How have you been feeling lately? With younger children, this may present more as a change in behavior or as an acting out, because they really don't have the experience or the vocabulary or the language to be able to understand big feelings. They're not really sure how to put that into words. So what you should start first is give them a vocabulary. I have behind me, I still use this with my son, and he's 11. I have it on a pillow. You don't have to buy a pillow. There's feeling charts everywhere. There's actually one over at HCN as well. You can use this to help have them point to what they're feeling in the moment. Give them language. Give them a vocabulary so they can communicate with you about what they're feeling and how they're feeling. So feelings can change. It's okay to be sad for a day. It's okay to have worry. We all have that, what we call that normal range and realm of feelings. But it's when we start seeing a change in the frequency, like how often is this happening? Am I having persistent anxiety and worry predominantly throughout the day? Intensity, are you unable to soothe your child, unable to comfort your child, unable to de-escalate a tantrum? That's frequency and intensity and duration. And is this happening more often, like more days of the week than not? So when we notice that we know our children better than anyone else. When we notice that we are seeing those differences in how they're feeling, like persistent sadness, excessive worry, mood swings, feeling overwhelmed, not just in response to a particular event, but in response to that it's happening more frequently than not, especially for a period of, a week, 2 weeks. If it's happening going on longer than that, then it might be a good idea to reach out to someone and say, hey, maybe we need to investigate further. The other big question is, how have you been acting lately? Changes in behavior that are troubling. And the way we view this, I'm literally pulling this from, we all struggle with labels, right? None of us really enjoys living with labels, but labels have a purpose. As a clinician, labels are a double-edged sword. They're not the whole person. They're a common language that we can share from professionals to other professionals, so that we can communicate with one another, and so that it serves for treatment purposes. Labels are almost a necessary evil, especially if you're working with insurance, because in order to use the insurance that you've paid for, labels are required for reimbursement so that provider can be paid. Another reason to probably have a panel in the future about talking about ways to work around that without having to use those certain labels. But changes in the way we diagnose is we use criteria that we come from this manual I just showed you. Please don't grab this manual and go diagnose yourself. Please don't do that. That's like Googling a strange mole. Don't do that either. But if you've got changes in observable behaviors such as eating and sleeping habits, a loss of interest in something that your child used to love doing, and especially once enjoyed activities, difficulty concentrating. And I don't just mean you're having that growth spurt where, let's face it, there are some times when your child's getting ready to have a growth spurt, you're not going to be able to keep them full and they're going to sleep extra long. I'm talking about observable changes in their routines of behaviors or in their mood, like I said, from anywhere from a period of 2 weeks or longer. That would be the time for you to reach out to the resources earlier and say, hey, I need a little bit more help on this. I need someone to help me kind of take a closer look at what's going on here. Okay, so why seek out mental health screening? Coming back full circle. The thing about living with labels is it's not the whole person. It's just a term. It's a common term that we use together as professionals so that we can communicate with one another, so that we can communicate with you, communicate with insurance. But there are ways around that. I'll give you an example. I would not go straight to, as a professional, when I would see someone in my office and just slap a diagnosis of depression on someone. Those are big labels that travel with you through life. I used a lot of adjustment disorders instead, because let's face it, life throws a lot of things at us and we're always adjusting to something, especially now. You can turn on the news and you will see. But if you go get the screening and you see you need to seek out further services, there are resources there for you. If you go get the screening and you find out, oh, okay, I don't need to seek out any further services. Here's some coping skills. Here's some things I can change in my routine. Here's some things I can change in my diet. Here's some options of things that I can do. Then it's going to give you peace of mind. And you don't have to go any further. You can hold on to that information and do something with it later. Sometimes you may not need intervention, and that's great. Screening provides you with information, and knowledge is power. So don't be afraid of the information. Other final thoughts. Having screenings out there and coming to be able to accept that mental health is just as important as your physical health helps remove the stigma of seeking services. The needs for mental health services is not going to go away. It's actually grown. But the access to it, the availability of it, is the issue that we're seeing. So that's why we're talking about this. We want to have more of you to be aware of what's out there. We don't want you to go it alone. You shouldn't go it alone, and you shouldn't suffer. Remember, 11 years, as we talked earlier in the screening, from the first onset of symptoms until intervention begins. 11 years. Don't let it be those 11 years. And finally, parents, this is for you too. I know typically as parents, we put our children first. We do it automatically. But you have to put on your own oxygen mask before you put on theirs when you're on a plane, and you cannot pour from an empty cup. You have to take care of yourselves too. So I wanted to say thank you for your time today and for listening. And you can find me at homeschoolcounselingnetwork.com.
Thank you so much for that, Kimberly. That was really helpful. A lot of really great resources. I shared in the comments a link to the free mental health resources that you mentioned. And I also gave a link to the playlist with your workshops, including understanding the function of big feelings, because you mentioned that, and I thought that would be helpful to people that maybe haven't watched that workshop yet. So, Sue, let's go ahead and switch over to you. Do you want to go ahead and share your screen?
Okay, share my screen. Okay. All right. I don't know why this is happening. Should I not share my screen?
Do you have the presentation open, or do you want to share the presentation directly?
Oh, yes, I can. Okay. Can you see my
Yes, we can see
presentation?
it.
Okay.
And then you can just go into presentation mode.
All
There
right.
you go.
Okay.
Let's go to the side here. Okay.
All right, thank you. So first of all, I'm really excited to be here. Thank you for having me. I'm also a homeschooling mom of 2 young kids, so I'm happy to be here. I enjoy helping other homeschool families. So we will get started. So my name is Sue. I'm a licensed clinical psychologist. I'm currently licensed in Texas and Illinois. I currently live in Texas in the North Dallas area. Uh, Before we moved to Texas, I used to work at the University of Illinois for about 5 years, working with college students, supervising graduate students. Currently here in Texas, I have a remote private practice that I work at part-time, and I specialize in ADHD, both assessment and diagnosing ADHD, as well as helping people manage symptoms of ADHD. So ADHD is very impactful. I'm going to be talking about early screening for ADHD, why it's important, what it might look like, and some signs to look out for to determine if maybe you need to get your child screened. So we know that approximately 10% of children are diagnosed with ADHD. I believe the age range for that is between the ages of 4 and 17. So that's about 6 million children in the United States who are diagnosed. And there are many more children, I'm sure, who are not diagnosed, right? So that's just a small portion of the actual amount of children who have ADHD. We also know that ADHD can impact academic functioning, it can impact social functioning, and it can impact mental health functioning as well. Children who have ADHD are more likely to have learning disabilities, depression, anxiety, oppositional defiant disorder, tic disorders, sleep disturbances. We know that adolescents who have ADHD have a higher likelihood of substance use disorder as well. So early screening is important because it can lead to early intervention. The sooner you can get your child screened, assessed, the sooner you can provide treatment and receive resources that will be helpful for your child. So when you're able to provide early intervention, we know that children who are being treated for ADHD, whether it's through therapy or medication or a combination of both, we know that those children perform better academically, they do better in school, they behave better in school. Intervention allows the provider to not only treat ADHD, but also to be able to treat the co-occurring mental health conditions that I mentioned before. And not just for kids, but if there's any families, if there's any parents out there who have a child with ADHD, you know that ADHD affects the whole family. It doesn't just affect the child. So being able to get intervention for ADHD allows the family and the parents to receive the support and the guidance that they need as well. Okay. So when do you screen? So first of all, I do want to talk about very quickly the difference between a screening and an evaluation. So if you're going to a psychologist, you're going to want to know the difference. So a screening is a very short, simple tool. It's not diagnostic, meaning it's not going to tell you whether or not you have ADHD. It's simply a tool used to determine whether further, a more comprehensive ADHD evaluation is warranted. So, yes, screenings are much shorter, typically 5 minutes, usually like a questionnaire form or a rating form that you fill out. And an evaluation, which I will talk about in a little bit, are much longer. It is very difficult to assess for ADHD in very young children, simply because there's a lot of variability of what's considered normal in young children, especially before the age of 4. And, obviously young kids, they're not going to be able to have, some of those self-regulation skills or the attention span, and that's very normal. For me personally, I probably wouldn't feel comfortable doing any sort of ADHD assessment on kids before the age of 6. But that's just me. I'm sure there's other psychologists out there who might, do an evaluation on, maybe younger children. But I would say, 6 is probably a good age to, if you're seeing some signs, maybe to get them screened or tested. So some of the signs to look out for. This is not an exhaustive list. These are just some common signs that you might see in children who have ADHD. So difficulty staying focused, being hyperactive, being restless, not being able to sit still, difficulty regulating their emotions. So, children who have very long, very explosive tantrums, angry outbursts. It's very common also for children who have ADHD to experience a lot of social difficulties. So not being able to take turns, not being able to, wait their turn, the back and forth in conversations, being unaware of social cues. It's also common for people who have ADHD to experience very poor sleep. If you're constantly feeling restless and you're feeling like you're not able to relax, it will affect your sleep. Forgetfulness, losing things, forgetting what you were told just a few minutes ago. Those are all very common signs. I will say, depending on the age of your child, you want to know what is actually appropriate for your child's age, right? So what is appropriate for a 6-year-old is obviously not going to be different for a 15-year-old. So first, you have to know what is appropriate and have appropriate expectations for your child. But I would say the key words here are, does it impact functioning? And is it observable in multiple settings? So by functioning, what I mean is your child unable to do the things that they need to do that are age appropriate, right? If it's getting to a point where these behaviors are impacting their ability to function in their day-to-day life, it's impacting their ability to learn, it's impacting their ability to create friendships and relationships, if it's impacting their relationship with other family members, that's a sign that maybe a screening at least is warranted. Also, the other keyword is being observable in multiple settings. So, it's not just when your child is at home that they display these behaviors. It's not just when they're doing school. It's not just when they're bored. But is it a consistent, observable behavior that you're seeing in multiple settings? Are multiple adults in their lives, whether it's, parents, other family members, other teachers or coaches, are they kind of seeing similar problematic behaviors? Then you probably need to get your child screened. Okay. So there are many, if you are wanting to get your child screened, there's a lot of free online screening tools. You can probably just search free ADHD screening online and you will get a whole list of resources that, very short screening measures that you can fill out to, see, are these behaviors that I'm seeing actually signs of possible ADHD? And like I said, these are free, very accessible. You can also go to your pediatrician or your physician. Typically, they will have some sort of ADHD screening measure, like a questionnaire form that the parent can fill out. That's very short. If you do decide to go ahead with a more comprehensive ADHD evaluation, that can last anywhere between 4 to 6 hours. It's possible that it may last a little longer depending on if there's any complex factors in the child's background, if there's other co-occurring mental health conditions, if there's a history of trauma, if there's learning disabilities. It might take a little longer, but typically 4 to 6 hours, I would say, is pretty standard. For younger children, the evaluation will span multiple days just because, young children can get very exhausted, they lose focus. And during these evaluations, we want the child to be, putting forth their best effort. So don't expect, your 6, 7, 8-year-old to, do a full day's worth of evaluation. For older children, for adolescents and adults, it's quite common to just spend the whole day doing these evaluations. So an evaluation will consist of a clinical interview, gathering information about the child's presenting problem, their background, medical history, mental health history, family history, how their social relationships are, all of those things with one or both parents and the child as well. You will probably be given a lot of questionnaire forms that you'll have multiple people fill out. So typically the parents will fill one out. If the child is old enough, the child will fill one out for themselves. There's typically a teacher form that a teacher fills out. If you homeschool your child and you are the child's teacher, then someone like a coach, someone at church, who knows the child, or if they're in extracurricular activities or other things like that, other teachers or other adults in their life who see them regularly, consistently, and can attest to some of the behavioral problems that you're seeing, then they would be a good person to fill those out. And then formal testing on the child. So this can vary. It can be, having the child do some things on the computer, having them look at pictures, solve puzzles, different things like that. And so that will typically take about 4 to 6 hours. Okay, let's see. All right, so the big picture. I think many people have the misconception that ADHD is an attention disorder, and that's partly true. ADHD is really a disorder of self-regulation, being unable to regulate all parts of yourself, whether it's your cognitive, thinking ability, your attention, your emotions, your behaviors. So it's an inability to regulate yourself, and it affects all areas of your life. It affects, their development, their identity, their relationships, their academic performance. I mean, if I've diagnosed adults with ADHD in their 50s, and they often tell me, like, gosh, I wish I had known this when I was younger. If I had just gotten the help that I needed when I was a child, my life might look different. I actually had a family member recently, just within, was it maybe last month or 2 months ago, get diagnosed with ADHD in his 40s. So, it's never too late, but really, the earlier you can get your child assessed and diagnosed, the earlier they can be provided with the intervention that they need. So I would encourage the families here, if you see signs maybe of ADHD in your child, I would encourage you to at least, go for the free online screeners. And depending on the results of that, you can, get referred to a psychologist who can do a more thorough evaluation. And if it turns out that your child doesn't have ADHD, then that's great. That's still good information. But I would encourage everyone to not wait and allow your child to get the resources that they need. So that is it for my presentation. Thank you so much again. You can find me on my website, maplepsychological.com. I provide therapy and assessment for ADHD. This isn't on my website, but I also do have a limited number of sliding scale slots available for both therapy and assessment. So the best way to reach me is through my email, or you can go to my website and fill out the comment form. And then, if you have any questions, feel free to reach out. Thank you.
Thank you so much for sharing that information, Sue. That is super helpful. I think that people are going to be able to use this information that everyone has presented today to really be able to help their kids and be their kids' advocate. And I think that that is really what homeschooling is all about, is being your kid's best friend and advocate. So I appreciate you guys for sharing all the really great information, and I'm really looking forward to our next mental health expert panel that we are going to be doing with everyone here.
Can I also share a little bit more about Dr. Hahn for just a moment? Dr. Hahn
Absolutely.
is very, very passionate about ADHD and about helping families. She's actually featured on the Homeschool Counseling Network as our podcast guest for this month. So if you would like to hear her more in-depth conversation about that and learn a little bit more about how you can help homeschool your child with ADHD, hop on over to our website, and our podcast is linked there. We also have a video version of it over at our YouTube channel, and we also have it on rss.com. So Dr. Hahn is a member of the Homeschool Counseling Network, and she's a homeschool mom herself, and she definitely supports us in this. So a lot of wonderful information in that interview.
I went ahead and shared a link to where people can be able to check out the podcast as well. Thank you guys so much for joining us, and I look forward to our next one. If you guys have any questions, make sure that you share them in the comments, and I will make sure that Kimberly, Sue, or Amy is able to get an answer to you. So if you guys are watching this on the replay, you are included too. So go ahead and share your comments and any questions that you have. The replay should be available in the next 10 minutes. I know Julie was hoping to be able to catch the first half of that